I would now request Dr. Raheelah Ahmad, who is the Senior Lecturer, Health and Management and Director for Global Engagement at City University, London. Dr. Raheelah will be talking about study design, systematic review, and Prisma. Over to you, Dr. Raheelah.
Assalamu alaikum, and thank you very much for having us here. Is the sound okay there, Mariam? Yes, I'm assuming it's all okay. All right, so thank you so much for having us here. I think I've got about 20 minutes that I'm going to speak for. And really just to say, first of all, the enthusiasm, dedication of Dr. Zaki is commendable, and we would have loved to have been there in Pakistan ourselves, and we have been there previously, but we met in London instead, and we got together to ensure that the content was exactly what's needed for the audience that we have. So we're delighted that we've got so many people participating. And this workshop is really about strengthening the capacity for peer research, peer review of research. And this research can be for publications, as Helen has talked about, but it can also be for peer reviewing research for grant applications. So we hope the applicability of this work is going to be wide-reaching. We hope this workshop and the activities that were pre-workshop activities and the activities we're going to do today will help you in your role as a researcher as well. So the idea is that it strengthens capacity. Dr. Zaki's already talked about the ecosystem, the peer reviewer being part of the ecosystem. And I just had 3 little pointers on that and link that to the pre-activity workshop that we had. I should add, in terms of the introduction that Mariam has given, thank you very much for that. I've also been Senior Associate Editor for 6 years for the journal Public Health, and I'm a grant reviewer for the Medical Research Council and the Health Review Board Ireland, and also the NIHR panels in England. So it's with that collective experience that we talk here today. So effective peer reviewers, particularly for those of you that are new to this, and we hope we're going to get lots of new peer reviewers coming on board, say no if the paper is outside of your expertise. You cannot be an expert in every area. Methodologies, there's a wide range of methodologies, and we're going to talk through some of those today. And this brings us to the findings from the pre-workshop activities, where we gave you 3 abstracts, exactly as they were written when they were submitted to the journals, and asked you to act in the role of Helen Crisp, which is the editor, and say, would you pass these on for peer review or would you reject them? So for those of you that did complete the activities, and many of you did, thank you very much for that. The first abstract, essentially 32% of you said you would reject this. And what is really interesting in the relevant bit, you were quite definitive. You were either yes or no, and not many people said they were not sure. This was the decision on this. This abstract was asked to be revised, but with minor revisions. So there is a discrepancy with how the participants viewed this. Let's look at the next one. Abstract 2, a few, but only 3% of you said not sure, 33% said reject. The review's decision was accept, but with major revision. Now, the most interesting one is the third one, which was the economic study, where 6% said not sure, a majority said yes, and only 17% said a rejection. Now, in terms of this abstract, it was passed on for major revision, but prior to that, it was rejected by 2 other journals. So in fact, the performance of this abstract was the weakest in reality, but actually came up strongest in the participants' views here. So we hope that today we can address some of those discrepancies, and that you would now reflect back on these activities, and maybe we can see how you might come up with decisions closer to this. We will put up the full papers now at the same portal, so you'll be able to revisit them. But thank you again for engaging with this. In terms of just strengthening your knowledge of the range of methodologies that are out there, there are lots of resources, but this is a great one, and it's based around the sort of the quality of different methods and approaches. So if you come into it looking at the best quality of different methods and methodologies, you're then going to be A, conducting good sound research, but B, being able to provide good peer review according to these guidelines. So we encourage to look at these resources. The second and third points, very quickly: submit your review on time. That's what editors want. And remember, as Helen said, the authors have spent a lot of time. So always be polite in your reviews and always be constructive. So I'm going to now move on to methodology, and I'm going to be covering qualitative research with an overview of designs. And that's really with the aim of helping you to start to think about how different methods and methodologies within qualitative research can be differentiated. So when you're looking at a paper and it says, this is a case study, what should you be looking for? And thinking, well, is this another study design? And Dr. Shahzad in his talk quite rightly mentioned that methodology is usually least well described. So we're focusing on that. And then I'm going to do a quick review of the Prisma checklist, again, how you can use that in terms of your peer review. So I'm going to stop sharing slides for the minute, and I'm going to try and just get up an overview here of qualitative study designs to help just think about what is the range. So I'm going to go through this in a little bit of detail, but I will, as I said, these resources will be available and you'll be able to look at these in your own time. So let's see if I can just get this up. Hopefully that's clear. You can see the top lines there. Qualitative research approaches. And what you have got here are 1, 2, 3, 4 different research approaches: case study, phenomenology, ethnography, and narrative or historical cases, sometimes they're called. Now, some of you may be familiar with qualitative research, others won't be, and it's something that you won't ever do. That's also fine. But being at least familiar with the kind of research that can go on. And this is really important because Professor Paul talked about sort of the messy reality, and qualitative research can often get at that messy reality. So that first one there, if we go across and look at definition, data collection, data analysis, and then what you might look for in the manuscript, so to differentiate it from others. What you'll also notice in this chart is that data collection is similar across phenomenology and ethnography. So you can have different data collection methods that fit across different study designs. And the analysis, really pretty much you can have any one of these data analysis methods across these study designs. So that chart I hope is helpful. Let's just pick out some key points here. So case study definition: focus on a single person, organization, incident, or phenomena. This would be great for your quality reports. You're looking at a unit of analysis, which is an organization, for example. But you can also have multiple case study designs where you're comparing different organizations, for example, hospitals. Data collection is typically textual sources, policy documents, any secondary sources and interviews, and your data analysis is there. What would you be looking for as a peer reviewer? You'd look for in-depth analysis as well as description, and you can look for explanatory or exploratory analysis. You want to be able to define the case really clearly so that you can see how this is generalizable to other settings. So if you've got a study that is about an urban hospital in Karachi, well, you need to say a lot more than that. You need to be able to say size, how is it in comparison to other hospitals, what's their case mix, what's their staffing, historical, financial characteristics, so that you can actually then say, how will this relate to a hospital in Lahore, and also in terms of demographics. So having that rich description is really important. Let's move to another one, ethnography, which is quite popular as a research approach. It's popular, but it's also overused as a term. And sometimes what researchers have done is observed a setting for a few weeks, and they call it ethnography. Ethnography in its truest sense, and that's what you'd be looking for as a peer reviewer, should really be about immersing yourself in a setting so that you can study behaviors, actions, and outcomes. And you potentially, normally you would be there for months and even years. You know, the big studies have meant researchers are there for years as well. The methods you see are not unique to this methodology. But what is important for you to look at from a peer review perspective is, what is the role of the ethnographer? Are they from the setting where the study is going on, or are they external? So I would be seen as external to Pakistan. Although I have Pakistani heritage, I cannot know what it is like to work and live and breathe in Pakistan on a daily basis. So I would be an outsider essentially, whereas some of the people we have in the room today would be insiders. So those are some things that you might look at. So let me just go to the last one there, narrative, sometimes called historical cases. The differentiation between this one is that you're looking at chronology. So it's a longitudinal account over a period of time, and you're reconstructing a story. Phenomenology is key when you're wanting to get different perspectives from different stakeholders. This is really important in healthcare and health services research, because a voice that is often missed is the voice of patients and public. And more of our research, particularly from Pakistan, does need to have the perspectives of patients and public in conjunction with the perspectives of healthcare professionals and policymakers. So that's a very quick overview. We will put this back up on the portal from where you did your activity. So hopefully that will be helpful to look at. I'm now going to go back to my slides so that we can proceed with the next. Sorry, just bear with me slightly. With the next part of this, which is looking at the systematic reviews. So we have the Prisma checklist. You were given that in your pre-activity pack, and I'm going to just provide you with a little sort of few tips as to how you might use the Prisma to carry out your review. So preferred reporting items for systematic reviews and meta-analysis. This is where you can find the tool. You have been provided with the tool. And really what you're looking at is the checklist, which sits in that top corner under key documents. So it's equally useful for you conducting research and for you evaluating the peer as a peer reviewer. Okay, so that's what we're going to do now. So let's have a quick look at the checklist. It is quite a long list, but that shouldn't put you off. The idea is it's very comprehensive. And as we know, the strength of a systematic review is the method. It's following that recipe step by step. And the more comprehensive you are against the method, you have a stronger study. But in addition to that, your research question or why you're doing a systematic review has to be relevant. There are some questions, research questions, which cannot be answered by a systematic review. And some of you might like to think about what those might be. And we can pick them up later when Enrique does his interactive session. So the question I have for you to think about is, think of a research question which cannot be answered by a systematic review. So what is not a good, when is it not a good method? That might help you think about the paper that you're reviewing, saying, well, why did they do a systematic review? Was it relevant? I have gone through and just filled in green what you as a peer reviewer might do with this checklist. So you can see some are fairly obvious, but these are all the comments that you can give. As Helen was saying, be really specific. So you've got a systematic review that's been sent to you. Is it in the title? Now, most journals have a convention where they ask for the topic, study design. So it should say the topic, and then it should say : systematic review. You can make that as your suggestion. Check the journal guidelines for the abstract. But let's move to point 4. Check that there's a clear aim or research question, as I was saying. And that should really come just after the background section, before the methods. And if you're unsure, please head to the Cochrane Library to see what systematic reviews should look like in terms of questions. And I will show you a little example in a little while. Is the Pico framework explicit? I'll show you exactly what that is as well. Then look at their eligibility criteria. How have they defined that? Is it clear? Could you, as a peer reviewer, go and try and replicate this method? Could you try and do it yourself? Or would there be gaps and say, I don't know what to do here? So this should be comprehensive. And again, I've given some pointers here. Is it about human health, animal health, or environment? And you might be thinking, why am I talking about animal health? Well, if you're talking about something like antimicrobial resistance or zoonosis, you might be looking across health sector, across sectors. Population group, setting, country, where, private or public health sector, all of these things need to be stated. So these are all the things that you can ask in your role as a peer reviewer for the authors to clarify. Have they said which databases they've used? I've added here the databases which you would expect to be used. This is not a definitive list. There are more databases, but this is a fairly comprehensive one nonetheless. So I've added those in. And then have they supplied the search string? So remember, the key with a systematic review is it should be repeatable. Somebody else should be able to go and do this. So you can ask that question. You can say, and then if you've noticed some key terms are missing from the search string, you can also say what they might be. Selection process. You do need to see from the authors who screened the titles and abstracts. Okay, so was it one person sitting in a room by themselves doing it? That is not of sufficient quality. You do need at least 2 reviewers. And I've put there an example. 2 review authors independently assessed study eligibility, extracted data, and assessed the risk of bias of included studies. Data were checked for accuracy. The quality of the evidence was assessed using the GRADE approach. Now, the GRADE approach just happens to be one approach for clinical studies, and I've provided a link there when you go back to these resources so you can look that up. So hopefully you'll come back to that. I hope you're getting the idea of the Prisma checklist. You go through each of these, you look at the paper and see, can you see this being reported? If not, then ask the authors to do so. Now, some of this information is contained in supplementary information provided when the authors submit their paper, because there just isn't the space to do it completely within the 3,000 or 5,000 words that are allowed. So you should check if it's there. I'm now going to skip to the bit about the contribution, and that would be in the discussion section. So Helen in her talk said that in their journal, sometimes it's not really, world-changing, cutting-edge, new. It doesn't have to be. So it is really dependent on the journal that you're looking at. Sometimes it's about implementing new interventions, as is the case as described by Helen. Some journals are looking for new innovations or interventions. So it's really about what is the contribution to the field in which the authors are claiming a contribution. So what are they saying they are contributing to? Now, this is what comes back to your level of expertise and knowledge, but this is a great opportunity for you to go and find out. So there are many papers that come, and even now I'm looking at them thinking, I don't really know enough about this field, but I'm going to find out a bit more so my review can be more helpful. And at the same time, I'm learning about the new field. It's a great way of keeping up to date as well. So that's the Prisma checklist. Let's just go back again to the slides. And thanks for bearing with me, flipping back and forth, but I didn't feel putting the Prisma checklist on a slide was a good idea. And you can see it exactly as it is. Here is an example of the Pico framework. So population, intervention, comparison, and outcome. And you would want to see this stated in a systematic review. So here in this example, techniques of monitoring blood glucose during pregnancy for women with pre-existing diabetes. This is from the Cochrane Library, which I pointed you to you earlier. Population clearly defined: female, adult, child, pregnancy, pre-existing diabetes. Intervention, blood glucose monitoring. That is the intervention. But often the intervention is a bundle, and that's definitely the case when you're looking at quality improvement. It still should be explained, as Helen said, describe all of the components. Comparison, and then the outcome. And Dr. Nina Zhu is going to talk a little bit more about outcomes in terms of quantitative outcomes. So that's the Pico. You want to see that there. You would also obviously want to see this familiar thing, hopefully to many of you. This is from one of our papers, and that is really the Prisma Flowchart. So you want to see how many papers were found, how many titles were found, and step by step, how many papers were removed at each of these stages of identification, screening, eligibility, and how many were included in the end. You want to see the reasons why studies were excluded as well. And here you can see the reasons, and the papers are grouped in there. As a reviewer, you can also question authors to say, I have found a paper which is looks like it would have been included. I don't see it in your final pool, and ask them just to comment on that. So if you know the area and you have expertise and you think, I would have expected this paper to make it according to the eligibility criteria research question, and you don't see it there, then do say so. Obviously, it shouldn't be because it's your paper necessarily. It may be your paper, but that shouldn't be the reason why you're asking them to find it. Okay, so those are my slides. I'm going to stop sharing. And I just wanted to just come back very briefly, because I think I've got a minute or two, to say about the pre-workshop activities. So whilst I showed you the statistics that showed that there was much discrepancy, but just validates the need for this kind of workshop, and hopefully we'll have many more activities like this collaboratively. It's really interesting to say that the third abstract, the economic one, we purposefully put that in because that was actually written by somebody who was not a native English speaker. And I remember Dr. Shazad at the beginning said, you know, this is an issue, particularly in low middle income countries or where the first language is not English. But although English is the language of instruction in medical schools, etc. in Pakistan, but when you're writing in this way, it's different. What was interesting, nobody who reviewed this in the participants mentioned how poorly written it was, how bad the English was actually. And maybe you were all being very, very polite, which is fine. But it was picked up by all of the reviewers when this paper was submitted. So that's just an interesting point to end on, but I'm going to stop there, and hopefully I've managed to do this a little bit quicker than the 30 minutes. So again, so I think if you haven't completed the pre-workshop activity, we'd really encourage you to do it. We put a lot of thought and effort into it, and I think the results that we got really validated the cases that we had picked. We didn't put the answers in terms of the published papers because we wanted to see what you would do. It was the best way to simulate exactly what happens. You know, an abstract comes through, you're looking at it, what would you do? I think probably sort of key points, maybe you may reflect and think that you would say not sure rather than yes or no. There are different options that you can go with: minor revision, major revision, reject. So if you are not sure, it's better to say that. It's also a really good idea if you can say which bit that you've reviewed and then say, however, I was not able to sufficiently comment on the statistical analysis, for example, or the qualitative analysis. If it's a mixed method study, it's better to say that. It then means the editorial office can go and find a reviewer who has that very specific expertise, and the authors get a rounded view. So that would be good. In terms of the activities, we asked for relevance and we asked for quality. So those are two different things. Relevance can be subjective because it is about the journal. You know, a paper can be relevant to one journal and be quite irrelevant to another journal. So as Helen said, if you're submitting to a journal, you should be reading that journal to make sure. One of the things you can do as a reviewer is to go back and see, have they actually referenced any other papers from the journal that they are submitting to, or have they almost picked at random the journal and submitted to that journal? They should be situating their work within the literature, within the field, but also within that journal, because it's for that journal's audience that paper is being assessed for. So you can give a really good, high quality, honest review by using some of these tips. And what Dr. Nina Zhu is now going to do is run you through, in her very superb way that she does, on the quantitative side. So I did qualitative and a systematic review. She's going to cover the quantitative methodologies. And I'll stop there now, I think, so I don't eat into her time. Thank you very much.